Hello and welcome to part 4 of the Psychosis lecture series. This is Dr. Nicholas Hatcher, and in this part of the series we will explore the presentation of psychosis. Here is a reminder of where we are in the series following our outline. At this point, we have discussed how various factors predispose an individual to psychosis, as well as precipitate psychosis, completing a stress diathesis model of psychosis. Now we will turn our attention to the presentation of psychosis, looking at key symptom domains and their underlying neurobiological correlates. The symptoms of psychosis can be grouped into distinct categories. These categories can be linked to core neurobiological abnormalities. For the purpose of this lecture, we will explore these symptoms in the context of disconnectivity along the key dopaminergic pathways discussed in the neurobiology section of this series. The symptom categories we will be discussing include the following: positive, negative, affective, cognitive, and aggressive. Let's begin with positive symptoms. Positive symptoms are symptoms of exaggerated normal operations of the brain and are reflective of abnormal activity along the mesolimbic pathway. This pathway extends from the ventral tegmental area, or VTA, an important site of dopamine synthesis, to the nucleus accumbens, or NA. The nucleus accumbens is located in the ventral striatum. The striatum as a whole acts as an integrative hub and connects to several regions of the brain. See Salgado and Caplet for a comprehensive review of the nucleus accumbens. Aberrant dopamine signaling here contributes to impaired function of the salience network, contributing both to delusions and hallucinations, an increase in the acoustic tone of inner thoughts, contributing to hallucinations, and a syndrome of passive receptivity, related to disrupted efference copy mechanisms. An efference copy is an internally generated replica of an outgoing motor signal that has the effect of dampening sensory perceptions occurring as a result of the motor act, encouraging it to be perceived as self-authored and avoiding attribution to an external agent. In addition to the influence by the ventral tegmental area, the basolateral amygdala and the dorsolateral prefrontal cortex also influence the activity of the nucleus accumbens. But what may normally be an inhibitory process is altered by stress, as is the case with the amygdala, and disconnectivity, as is the case with the dorsolateral prefrontal cortex. Although the neurobiology underlying positive symptoms is complex and still not fully understood, phenomenologically, positive symptoms come in 3 categories: content of thought, form of thought, and sense of self. Content of thought, as the category suggests, refers to what content is present in thought. In this domain, there are delusions and hallucinations. Delusions are fixed, false beliefs that persist despite evidence to the contrary. Delusions occur in several forms listed here. Hallucinations are an experience of an apparent perception of something not present. While auditory hallucinations are the most common, an individual may experience visual, tactile, gustatory, and/or olfactory hallucinations. Form of thought refers to the way in which thoughts are formed. Associative looseness is the most common variation in the form of thought that we see in psychosis, where there is an abnormality in the connection between concepts. A neologism is the production of a new word or expression that appears to be nonsensical. Concrete thinking refers to a form of literal thinking with absence of abstraction. Clang association is a grouping of words that usually rhyme or is based on similar sounding sounds, even though the words themselves don't have any logical reason to be grouped together. Word salad is an unintelligible mixture of seemingly random words and phrases. Circumstantiality refers to a circling around the point. where the individual has difficulty reaching the point of, for example, a question asked. Tangentiality is a derailing of thought form, where the individual tends to speak about topics unrelated to the main topic of discussion. Mutism is an inability to speak. In the context of psychotic illness, this occurs when the individual is overwhelmed by sensory input. And finally, perseveration is the repetition of a particular response, be it a word, phrase, or gesture, regardless of the absence or cessation of a stimulus. Some specific symptoms are reflective of sense of self that fall into the positive symptom category. Note that the negative and affective symptoms complete this picture of sense of self-related disturbances. Echolalia is a repetition of words, sometimes referred to as parroting. Echopraxia is a purposeless imitation of others. Identification and imitation refers to behaviors taking the form of those which are seen in another. Depersonalization refers to feelings of unreality. Negative symptoms are reflective of abnormal activity along the mesocortical pathway. The mesocortical pathway extends from the ventral tegmental area, or VTA, to the dorsolateral prefrontal cortex, or DLPFC, the orbitofrontal prefrontal cortex, or OFPFC, and the anterior cingulate cortex, or ACC. These regions are components of the ventromedial prefrontal cortex. The dorsolateral prefrontal cortex is the CEO of the brain, performing several executive functions. Some of these functions include temporal organization, language, response, stimulation, attention, creativity, explicit or declarative memory, and learning. The orbitofrontal prefrontal cortex is the oracle of the brain, performing functions that largely evaluate the outcome of stimuli, options, and choices. The OFPFC interacts with motor areas to influence behavior. Outcome encoding in the OFPFC may bias action plans in the DLPFC and premotor cortex. Outcomes encoded in the OFPFC may also bias activity in the striatum. The amygdala is a major source of outcome information in the OFPFC. The anterior cingulate cortex is associated with both cognitive processing and emotion regulation. The anterior region specifically is implicated in emotional appraisal, cognitive control, and error conflict. The negative symptoms of enduring psychotic illness are sometimes referred to as the A's of schizophrenia. These include affect flattening, autism or asociality, ambivalence, anhedonia, anergia, alogia, avolition, and apathy. Affective symptoms include a depressed or anxious mood, guilt, tension, worry, and irritability. To conclude the discussion on negative and affective symptoms in enduring psychotic illness, let's discuss some of the statistics on suicidality in schizophrenia. Suicidality is the leading cause of premature death in schizophrenia. 20 to 50% of patients attempt suicide. This population is 9 times more likely to reattempt suicide after discharge, which is coincidentally higher than those with major depressive disorder. The long-term rate of suicide attempt is 10 to 13%, and 5 to 6% die by suicide. Cognitive symptoms are reflective of abnormal activity along the mesocortical pathway. Here, symptoms are especially related to abnormal connectivity and dopaminergic activity between the ventral tegmental area and the dorsolateral prefrontal cortex. Some specific cognitive symptoms we may see include representing and maintaining goals, allocating attentional resources, focusing and sustaining attention, monitoring performance, prioritization, modulating behavior based on social cues, serial learning, and issues with verbal fluency and problem solving. Aggressive behaviors are related to abnormalities in the amygdala as well as the orbitofrontal prefrontal cortex. The amygdala is popularly known for its role in the fear response, but also has potential implications in evaluating things in the environment to determine their importance, whether positive or negative, and generating an emotional response to those stimuli that are considered important. It also may be involved in the consolidation of memories that have a strong emotional component, regardless of whether the associated emotions are pleasant or unpleasant. The OFPFC primarily receives input from the amygdala, which then guides the evaluation of potential outcomes. Often the aggression experienced in psychosis is expressed on links, as explained by the psychoanalyst Wilfred Bion. That is, the links between subject or self and object or other. This accounts for a lot of the disorganized and seemingly non-directed aggressive features in acute psychosis. This is a table summarizing the major symptom categories, individual symptoms, and pathways involved. For downloadable content such as written notes, PowerPoint slides, and more related to this lecture series, please visit my website using the link below. You can also support my goal of continuing to provide new content through Patreon, where becoming a patron will provide you with access to downloadable content as I create new content. Thank you for your support. Here are my references. Thank you for listening.